Claudia Sanchez, and I'll be performing my sterile dressing change checkoff. So first, you're gonna make sure that you look at the physician's orders and make sure that it's the right patient that you're doing it to. And then you're gonna gather your equipment, which are gonna be your sterile gloves, your sterile gauze, and your flush full of sterile saline. Or there's sometimes like a bottle that you can get that you can use as well. And then you're gonna use whatever bandage that the doctor orders for you to put on the wound and your medical tape. And then you're gonna go to the patient's room and you're gonna perform hand hygiene once you come in the door and provide privacy, which is close the door or pull the curtain so nobody can see while you're doing this procedure. After that, you're gonna introduce yourself to the patient as their nurse, and then you're gonna ask them to identify themselves to you by giving you 2 identifiers, which is their date of birth and their full name. After that, you will explain the procedure to them, why you are changing their dressing, and what the doctor has ordered for you to do. After that, you are going to put on gloves and you're gonna set up everything. So you're going to open your gauze from the far away from you to the inside. And as long as you don't touch the inside, it'll be okay. Everything inside will be sterile. So that'll be good. And then you'll take the saline out of the package. And you'll open it. And you take your gloves out too. So you have that ready. Throw all of that away. And then with your gloves, you're going to remove the bandage. And if it's small enough, you can just fold it and turn your gloves inside out and throw it away. So then you throw that one away. And before you do that, you want to know if the patient has had pain while you have done this in the past. So you want to offer pain medication so it'll be less painful for them. Then after that, with your gloves that you have on, you want to pull this out. And you want to throw that away also. And then you want to look at the color of the wound and the integrity of the skin and how it looks. It should look red, and it should look like it's healing up good. It shouldn't have any type of sloss or a scar in it. After that, you will throw your gloves away, perform hand hygiene again, and open up your gloves, your sterile gloves. Away from you first, and pull that apart. I do my left hand first, so then you'll and then with this, you'll grab with your fingers up here. You grab your thumb right there, and then with your fingers. And then you'll let go. Okay. That's good. And then once you're done with this, you don't want to touch anything else. So you'll grab your saline, you'll dump some in the trash can and put some, water some of them down. And you'll get the first one. you'll rinse some of the saline that you used out of it, and you'll clean right down the middle with that. And you'll throw that one away. And then you'll get another one and clean on the outside first and throw that one away. You'll get another one of yours and throw and clean on this side, throw it away. You'll grab another one, clean on the outside again, throw that away. And then do this, and you'll clean on that side, throw that away. And after that, you'll get another one, and you'll pack it in there. You might need a Q-tip to do this, and you'll slowly pack it in the wound. And then you'll get clean gauze, and you can put it over the wound, just like that. And then you can get your bandage that the doctor has ordered, put it over. At this point, you can take off your sterile gloves and put on new gloves, because everything that needs to be clean and sterile is already clean and sterile. So then you'll put on new gloves. So then you'll get your tape. And you need to be careful of the area that you're taping down, because if it's in a private area and you pull off the bandage, it can really hurt. So you want to be careful of where you place the medical tape that you're using. And then you'll tape that side. You'll tape it down on each side, because you want all of it to be down and firm. You don't want you don't want no other type of moisture getting into it. So then once it's done, you're pretty much done. You take off your gloves. Take off your gloves. You throw those away, and then you perform hand hygiene again, and you cover the patient back up, and you give them their call light. And that is it for the sterile room dressing checkoff. Thank you.